Hello and good morning or good afternoon to everybody, depending on where you reside, and welcome to Grand Rounds for the Minnesota Regional Spinal Cord Injury Model Systems, or as we call it, the MINSCIMS. We want to thank you all for joining us today. MINSCIMS is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR, to support innovative projects and research in the delivery, demonstration, and evaluation of medical, rehabilitation, vocational, and other services to meet the needs of individuals with spinal cord injuries. Next slide, please.
Thanks.
MINSCIMS represents an exciting partnership among the following Minnesota institutions: Courage Kenny Rehabilitation Institute in Minneapolis, Mayo Clinic in Rochester, Regions Hospital in St. Paul, and the University of Minnesota in Minneapolis. Next slide, please. Our community collaborators include the Minnesota Spinal Cord Injury Association, Unite to Fight Paralysis, Get Up, Stand Up to Cure Paralysis, the Paralyzed Veterans of America, United Spinal Association, and the North American Spinal Cord Injury Consortium. This system collectively provides a multidisciplinary continuum of care for people with spinal cord injury, including emergency medical, acute care, acute rehabilitation, and post-acute services. I'm Dr. Kimberly Mondin, and I will be the moderator for today's session. I'm an associate professor in the Department of Rehab Med at the University of Minnesota Medical School, and I am co-project director of the MINSCIMS with Dr. Leslie Morse. Next slide, please. Just a few housekeeping notes for today. The University of Minnesota has organized the CME for today's webinar. Please see the chat for information on how to record your attendance and claim CME credit for attending this webinar within 24 hours of the event. This meeting is being recorded and will be posted on the MINSCIMS website. Due to the number of registrants for today's webinar, we have placed phone lines on mute to reduce audio feedback. However, we welcome and encourage audience participation using the Q&A function. If you have technical or logistical questions, we ask that you please submit those in the chat to Dan Kelly. We extend a huge thanks to everybody behind the scenes to make this Grand Rounds possible, including Dan Kelly and Amanda Herman. Next slide. The title of today's presentation is Combating Tokenism in Spinal Cord Injury Research, Advancing the Science and Practice of Meaningful Engagement. The speaker for today's webinar is my colleague and friend, Dr. Heather Gainforth, and I'm really excited to have her here today. Dr. Gainforth is an principal investigator for the International Collaboration on Repair Discoveries, or ICORD, and an associate professor in the University of British Columbia, Okanagan. Completing her master's and PhD in kinesiology at Queen's University, Dr. Gainforth completed her postdoc research at University College London in the Center for Behavior Change. Dr. Gainforth is a behavioral and implementation scientist who leads the Applied Behavior Change Lab within UBC Okanagan's CFI-funded Center for Health Behavior Change. Dr. Gainforth's research program aims to investigate how evidence-based behavior change research is applied in real-world contexts and to advance the science and practice of research partnerships and integrated knowledge translation. Dr. Gainforth leads the Social Sciences and Humanities Research Council of Canada, SSHRC, funded research partnership that co-developed the first integrated knowledge translation guiding principles for conducting spinal cord injury research in partnership. We welcome and thank you for presenting today, and I will hand it over to you.
Sounds good. Thank you so much, Kim, as well as the team for putting this together today. It's a real honor to get to speak to a group that I have so much respect for, in particular, your partners and the organizations you're working for are groups that I've followed for a very long time. So it's nice to be invited by a friend, and then also really nice to speak to such an esteemed group. I do not have anything to disclose. However, I have listed where I've received funding for my research over the past 8 to 10 years. And with that, we'll get into this idea of combating tokenism in spinal cord injury research and talking about our research around advancing the science and practice of meaningful engagement. As Kim mentioned, I am Canadian and based in the province of British Columbia. You may have heard of the University of British Columbia, as well as ICORD, the International Collaboration on Repair Discoveries. What you might not know is that the University of British Columbia, we have two campuses, and I'm based on the beautiful Okanagan campus, which is on the traditional and the unceded territory of the Syilx Okanagan people. I like to say that we are the central campus because you might not know as much about us, but we are in the center of the province, based in what's known as Kelowna, British Columbia. But you've also probably heard of our campus maybe in Vancouver, British Columbia. And what I decided to do today is to show you the map that actually helps us understand the First Peoples cultural showcase of language, art, and culture from the First Nations around British Columbia. In Canada, we are going through a much needed process of truth and reconciliation. And for that reason, when I start a presentation, it's important that I acknowledge that I am on the traditional, the ancestral, and the unceded territory of the Syilx Okanagan people. The Syilx people are particularly maybe relevant to today, in that they are a nation that actually crosses borders. So I thought that that was neat because we're crossing borders today. So they do have territory that crosses down into Washington, and you can see where the Okanagan is based here on the map. I provided a little link here around Syilx history, as well as the truth and reconciliation process in Canada, and our very, very tragic history of how Indigenous people have been treated. Related to that and to Syilx culture, I also wanted to highlight that right now we are in the time of the salmon, and highlight Chieftain TTE. So in Tsiltchin, Chieftain TTE represents the chief that is all that is water. And for Syilx people, the chief that is all that is water, and the spring salmon represents this idea of perseverance against working against the current or the culture, taking action in a confident and focused manner, and the importance of taking care of one another in a good way. And for me, this has really guided some of my thinking around how I think about our work in combating tokenism, because I think that these characteristics are the same characteristics that we will need to be able to combat tokenism in research systems, in the spinal cord injury research system, and beyond. We will need to be confident and brave, but also take care of each other while we do that. So today, we will be talking about 3 areas around combating tokenism in research. So first, I'll summarize the evidence on tokenism, as well as some evidence on meaningful engagement. Then I'll tell you about our work around developing the integrated knowledge translation and guiding principles for conducting and disseminating spinal cord injury research in partnership. These principles are essentially designed to combat tokenism in the spinal cord injury research system. And then we'll talk about some considerations and tools for supporting partnered research in spinal cord injury and potentially beyond. So maybe you're like me and you're a fan of PhD comics, but essentially what they've said is how research is supposed to work. We're supposed to write a grant, then we're supposed to get the money, we do research, and then we publish the results, and we repeat, and we repeat, and we repeat. And the problem with this approach is that our endpoint is publication and not application. And so it means that our system continues to sacrifice real-world impact, where beneficial research that could support the lives of people with spinal cord injury rarely makes it to real-world practice. In Canada, we aim to address that challenge through the process of knowledge translation. You, I believe in the States, use terms like dissemination and implementation, D&I, but you also might have heard of topics like knowledge exchange, knowledge translation, knowledge mobilization. When we talk about this idea of knowledge translation, we use the Canadian Institute of Health Research definition, and that includes 4 key areas. So we think about the idea of synthesis, that we are distilling down many forms of evidence and knowledge to create guidance or evidence-based, say, recommendations, practice. Then we have this idea of exchange, the two-way sharing of knowledge between people who are paid or have formal positions to do research and the people that use our research. That could be policy, it could be people with lived experience, it could be clinicians, it could be other researchers. Application, which you may have heard of, this idea of implementation, actually putting that research into practice. And then different from that, dissemination, or what we sometimes call end of grant KT, which is communication, getting the word out, letting you know what the research found. So right now I'm essentially doing dissemination. I'm letting you know about my research, whereas application would be you actually taking up some of my research. When I'm talking about integrated knowledge translation and talking about meaningful engagement, that really lives in this idea of exchange in that Canadian Institute of Health Research definition, with the idea that that foundation of partnership would help synthesis, application, dissemination, and quality of research. When we think about partnering in research, though, what we find is that research funders, organizations, people with lived experience are encouraging or requiring researchers to partner with knowledge users, research users, people that would use our evidence on grants. We see that this aligns with calls from disability communities for there to be nothing about us without us. When we talk about this idea of partnering in our work, we talk about that as the idea of integrated knowledge translation because of the definitions used here in Canada. And our partnership defines that as the meaningful engagement of the right research user at the right time throughout the research process. Sometimes your research user might be a person with lived experience, but sometimes it might be a clinician, it might be another researcher. It depends on where you're hoping to have that work used and taken up. Many people ask me, what does meaningful engagement look like? Or what does my integrated knowledge translation process look like? And what I usually say is, as a behavioral and implementation scientist, what I'm often asking is, how can I help? So I'm trained to think about interventions, programs, tools that help people with spinal cord injury to adjust, adapt, and thrive after they're injured, often in community. For me, my research user is often community-based organizations that deliver programs and services to people with spinal cord injury. An example of that would be Spinal Cord Injury British Columbia. Spinal Cord Injury British Columbia is one of our largest community-based organizations in the province, and they offer services both within rehab and hospital, as well as once you're in community, with a strong focus on peer mentorship. And so I go to organizations like that and I explain what my skills are. I'm a behavioral scientist, I'm an implementation scientist. How can my research help? And they'll come to me with research questions. For example, how does peer mentorship work? What do we need to do to have the absolute best peer mentorship program? Or how can we help people change their bowel care routines? How can we help family and friends of people with spinal cord injury? Those are the types of questions I'm asked. And then with them, we write the funding application together. We develop the research methods together. We conduct the research together, whether that's them helping with recruitment, they might be involved in actually collecting data. And then from there, we analyze the data together. And that doesn't mean that they sit beside me at every single step. It might be that we do some analysis in my lab, go back to them, figure out how that's resonating, how practical, how pragmatic that work is, and then go from there. And then really where the power of these organizations lies is hugely in dissemination. Because we've done research that is relevant, useful, and usable to them, they are often disseminating faster than I can even have us write the paper. And because they've been involved in every step of the research process, they are co-authors on the research that we do. Now, you probably have heard different terms and approaches for the process I just described to you. So I call it integrated knowledge translation, but you maybe have heard terms like participatory action research, public involvement, patient involvement, community-based participatory research. There are tons of different words to talk about this idea of working in partnership. And in developing our guiding principles and thinking about our work, we wanted to understand, regardless of what term you used and what country you were in, what were the really underlying core pieces of what makes partnership. So with that, we went through a very intense process of a review of reviews to identify principles, strategies, outcomes, and impacts of different types of research partnership approaches. We went across multiple research areas within and beyond health. We went across different stakeholder groups, and we went across partnership approaches. In total, we looked at 85 reviews of reviews. So it was intense. And I wanted to highlight my former postdoc, Dr. Femke Hoekstra, who really led this work. In Canada, we definitely see the term IKT popping up, as well as community-based participatory research. In the United States, we see that you talk about participatory action research, community-based participatory research, as well as a variety of other terms too. Often people don't even tell you their term, but they're talking somewhere in this idea of the meaningful engagement of researchers and research users. And yes, there are nuances between these different approaches, but broadly what we find is that their core, the principles and the strategies across the approaches are more similar than they are different. And if you want to go into some deep dives, you're more than welcome to read that paper. It's open access. In terms of today, I think if we keep to this idea that we're talking about the meaningful engagement, it needs to be relevant, useful, usable of the right research user at the right time throughout the research process. That's how I think about our work and the goal of what I'm doing. I think we can stay on the same page. The other piece I would say about integrated knowledge translation and meaningful engagement is I also define it as the opposite of tokenism. So meaningful engagement and IKT do not look like tokenism. What tokenism looks like is when a partner is asked to endorse and therefore legitimize research programs over which they have little real control. So I talk about this as representation without agency. If the partner on your grant, if the partner on the project doesn't have any decision-making power, why are they there? And tokenism is likely happening in this case. There's a really great concept analysis of the literature about tokenism more broadly. And really what it says is that tokenism has these dimensions of unequal power, often with, say, a researcher over a research user, limited impact, you don't get to change very much, ulterior motives, I need to win the grant because it helps my career. I need to do this because I need the publication instead of actual meaningful engagement and impact, and the opposite of meaningful engagement. Now, I can tell you a lot about tokenism and what I've heard, but I think that my colleague, friend, and partner, Jocelyn Mathen, can tell you more. So Jocelyn works for Spinal Cord Injury BC, and she is a woman who lives with spinal cord injury and is a partner on our IKT guiding principle. And she also runs services and leads services within Spinal Cord Injury BC. So I'll let Jocelyn tell you about the experience of tokenism and research.
In some circumstances, the experience, especially the lived experience of someone with a disability or a unique background, for example, growing up in another country, speaking a different language, being LGBTQ or Indigenous, is a unique experience, or one that's hard to include in a lot of circumstances. Tokenism is what can happen when we treat that as a badge or a box to check in terms of incorporating that lived experience in our work. As a person with a disability myself, I've experienced some tokenism in my life where people have seen the value of my participation, but not recognized my engagement or not invited or included me in any of the process other than to be able to say that a person with a disability was involved in this process. If you think of the sort of spectrum or ladder of engagement, tokenism might be on the very low end. I think there are some reasons to have very low amounts of engagement. However, I think we're always hoping to move away from tokenism into an engagement that's valuable for that individual who's participating and valuable for the context they're participating in, the organization or the research partnership.
Right. I think Jocelyn does it much better than I can. So interestingly, with this idea of meaningful engagement and the idea of how can I help, what I thought my career would be designing behavioral interventions with and for people with spinal cord injury, avoiding tokenism when I do that, and partnering for impact. Interestingly, early in my faculty position at UBC, I was speaking with some partners and we were talking about the challenges of research partnership and impact in spinal cord injury research. And partners that worked in organizations around spinal cord injury said to me, if you're such a great behavioral scientist, can you change the researchers' behaviors? And I felt a little sick and wasn't really sure how we'd do it. And I said, we would have to change the entire research system for us to be able to do that. And the partners around the table said, so that's how the idea of the guiding principle came to be. So we started thinking about a rising tide lifts all boats. And how can we transform a system to support meaningful engagement and combat tokenism in spinal cord injury research, but also beyond spinal cord injury research? I not only heard about the challenges of meaningful engagement, but I heard some really heartbreaking stories of how people with lived experience and partners were being treated by scientists. So I think there was a rising tide of how can we help people that are interested in partnership, but also how can we make sure that when people with spinal cord injury or other partners are asked to partner, they have a quality experience. Because when we engage in tokenism, we disenfranchise them from research. So that gets us to our guiding principles. So I'll tell you a little bit about what the principles are, and then I can tell you how we co-develop them as a partnership. So the 8 principles were co-developed by a team of researchers, research users, and funders. Principles are essentially the fundamental norms, rules, or beliefs that represent what's desirable or positive for a person, a group, organization. And what they help us do is determine the rightfulness or wrongfulness of our actions. They are quite basic in that they're not policy, they're not rules, but they could govern both of those. I like to think about principles as the head and the heart of what you're doing. I can't necessarily see you doing principles, but I can see the strategies you use to make those happen. They guide everything you do. So based on literature, and I'll tell you about that process, we established 8 principles. So to engage more meaningfully in research that is relevant, useful, and usable, and avoids tokenism, we say that partners need to develop and maintain relationships based on trust, respect, dignity, and transparency. It seems like such a simple statement, but this is probably one of our most complicated pieces. Building trust, it takes years to build and can be gone in a second. So it's something you really need to think about how you build trust with partners. Partners share in decision-making. That means we all have decision-making power or agency, whether we're a researcher or a research user. And this is really our principle that is there to directly combat tokenism. We foster open, honest, and responsive communication And we recognize, value, and share diverse expertise and knowledge, which means that not all expertise comes with a PhD. Lived experience is valued, different forms of knowledge are valued, and PhDs are also valued. All of those pieces of knowledge are respected. Partners are flexible and receptive in tailoring the research approach to match the aims and the context of the project. This has been really important in our different projects and work, in that we adjust and adapt to the PhD student that's working through a deadline, but we also work with the organization when they had a tragic event happen or a giant pandemic happen. We have to be flexible and receptive. Partners can meaningfully benefit by participating in the partnership. This is also important for tokenism. We need to understand why everybody is coming to the table and that they're getting that experience, they're getting that benefit. Partners address ethical considerations, whether that is the ethics and the confidentiality of being on the partnership, as well as the ethics of the actual research process. And then partners respect the practical considerations as well as the financial constraints of all partners. That's everyone from the graduate student all the way through to the actual organization and partners that might have practical considerations. So who actually developed these? So we used a partnership approach to develop the guiding principles. So we established a very strong North American team of spinal cord injury researchers, organizations, people with lived experience, health professionals, research funders. We wanted to represent people that work within the system of spinal cord injury research. If we are thinking about engaging the right research user at the right time for the guiding principles, we need people that have decision-making power in the spinal cord injury research system. So that means research funders and institutions. It means community organizations and people with lived experience. And it means researchers, both spinal cord injury researchers, as well as researchers interested in the science of partnership. We wanted to make sure that we were using very strong, rigorous approaches to develop these guiding principles. If we're going to convince researchers to change their behavior, we need to meet them where they see quality evidence. So we use the appraisal guidelines for research and evaluation 2 instrument. This instrument is used to develop guidance such as the physical activity guidelines for people with spinal cord injury, as well as lots of clinical guidance around the world. We systematically reviewed the partnership literature, and I'll tell you a bit about that. And through that, we identified 125 different principles that were underlying research partnership, regardless of your approach. So our first step with that was to do that long list development. And I've already showed you one review that helped us with that, the review of reviews of the spinal cord injury literature. But we also conducted a scoping review, review of reviews of all partnership literature. Then from there, we did a scoping review focused specifically around spinal cord injury and related disabilities. And then we did a series of 2 interview studies to understand from champions who use partnered research, both researchers and research users, what principles were they using and what strategies were they using to guide their work. That got us to that list of 125 principles. And then we put that through a Delphi consensus study where we asked people with spinal cord injury, we asked researchers and research users which principles they would recommend should be used to guide spinal cord injury research partnerships. And that got us down to 35 potential principles. From there, we came into a room at Spinal Cord Injury BC in Vancouver, and over 2 days deliberated over these 35 principles to essentially whittle them down to those 8 principles that you saw, and came to 100% consensus on our final 8 principles. From there, we sent those principles out for expert feedback with both researchers and research users. And received very strong feedback that our principles were relevant, useful, usable. If you want to learn more about the co-development process and how we did that, this paper is also available open access, published in 2020. So since 2020, we've acknowledged that our principles probably are important for setting a standard, the rightfulness, wrongfulness of partnered research in spinal cord injury. but we've worked really hard to disseminate them. It is one thing to tweet a paper and publish something, but that's probably not going to change the system. That's not going to get research users to change the way they do things. So we absolutely worked hard to create webinars and videos, and we've traveled all over to tell people about them. We've done workshops, we've been on podcasts, conferences, and created tools. And since the publication of them and our formal launch in 2021, we have seen the principles absolutely have an impact. We've seen visits to our IKT Guiding Principles website from over 40 countries, more than 400 downloads, and they have been cited in the Lancet as a powerful approach for ensuring research is relevant, useful, and used. So we're quite proud of this, but as a behavioral scientist, dissemination is an application. We already talked about that earlier. And so we're really working towards supporting adoption, implementation, meaningful engagement across 3 groups, and using the science of behavior change to change our own system. So we're looking at researchers and how we change them to support the use of the principles, knowledge users, as well as funders and institutions. Now, for today, I wish that I could tell you about our different research projects in all 3 of these areas and how we're understanding how we can change science in all 3 of these areas, but unfortunately, we don't have the time for all of that work today. But I recognize that there's likely many researchers on this call, and then I'll point to some of the work being done with research users or knowledge users as well. So let's talk about some considerations for supporting partnered research. So I already told you about our review of reviews. And when we did our review of reviews, we were looking at specific things. We were looking for the principles people were using, their strategies, their outcomes, and their impacts of partnered research. And one thing we were really looking for in the outcomes and impacts was the challenges people experienced. From researchers, we heard that the additional time and financial burden of partnered research was a challenge. And they also had uncomfortable feelings associated with power sharing and sharing in that decision-making. It's often not the way that researchers have been trained to do their science. From stakeholders, or what I would call a research user, knowledge user, feelings of tokenism, of disempowerment and overburden, which is just going to disenfranchise people from working in a research system. Partnership level, the conflict between researchers and stakeholders, different priorities, different needs, not acknowledging those practical financial considerations. And at the research project level, we continue to hear about the worry of biased data. And we can have a long discussion about what counts as biased data. But I think really seeing that partnership can add quality and can add relevance rather than necessarily bias. We also looked for the strategies. So how are people overcoming some of these challenges? How are they working through it? We found 115 different strategies, and then we organized those into 11 different strategies and created a little bit of a almost taxonomy of strategies to help people think about how could they begin to partner. I can't tell you about the effectiveness of these strategies because data on research partnership in that way, it's not strong enough yet, and we are moving to think about multiple case studies. But what I can tell you is that we organize them into a little bit of a recipe. So we say that strategies broadly relate to the idea of resources and time, engagement strategies in the research process, communication strategies, initiatives around your collaborative meetings, your conferences, your events, how you initiate a partnership and have representation and inclusion on that partnership, and then education and training. And then we did some work to actually do a matrix where we took those different strategies and showed you how they could hit different principles. So one strategy might help you do several principles. And all of this work is available through our Guiding Principles website, where we're really trying to create a hub that helps researchers, research users, funders, institutions in spinal cord injury research have a place to go when you're struggling and having those challenges in partnership. So let's focus on this research piece. And I want to show you how we're using the science of behavior change to support researchers specifically around those challenges. So this is work being led by my PhD student, Allina, where we wanted to understand how we could support partnerships among researchers, but really understand why can they not follow the principles. So Kim already mentioned that I did my postdoc at the University College London, and I did that under the supervision of Susan Mickey and Robert West. Mickey and colleagues are the developers of the behavior change wheel and have a strong background in theory. So it makes sense that we would use theory to understand the behaviors of researchers. And we use the capability, opportunity, motivation theory, or the COM-B model. And with this approach, what it says is that in order for anyone to engage in a behavior, including adopting our principles and engaging in a research partnership, you need to have the capability, you have to have the skills and the knowledge, you need to have the opportunity, you have to have the physical opportunity, the resources, the time, but you also need to have that social opportunity of people thinking it's a good idea around you. And you also need the motivation. You got to want to do it. If you don't want to do it at the end of the day, probably also not going to happen. But if we don't have these three things, it's very unlikely that we'll engage in the behavior. If you're having troubles remembering capability, opportunity, motivation, just think about it as the same three things the legal system decides in terms of could you have committed a crime. You can't engage in the behavior if you don't have capability, opportunity, or motivation. So what we did is we interviewed 9 spinal cord injury researchers, and we also surveyed 22 spinal cord injury researchers to ask them the question, what stops you from using the principles and what stops you from partnering? You can see that we had researchers from Canada as well as the US, and I was pleased to see that we also were able to recruit researchers working across several different domains of spinal cord injury research, from bench to bedside to what I would say I am a backyard researcher. We did in-depth interviews to really understand why they can't follow the principles, but we also got them to rate each principle around why they couldn't follow it, and would it be capability, opportunity, or motivation. What you can see across the different 8 principles is that each principle represents slightly different challenges for people, but overall, motivation was higher on every principle. We saw that people wanted to follow the principle, but it was their capability and their opportunity that usually needed consistent bolstering. So doing more interventions to tell people how great partnership is likely not the way we need to go. We need to start building skills, and we need to create opportunities for researchers to partner. In terms of our quotes, we heard some great ideas around what partnership could really look like. So one person said, I think that probably the biggest barrier is trying to fit in with the research system, which currently doesn't really value or accommodate research partnerships, especially as someone who you know is new in their career. It's hard because it takes longer when you don't get the research outputs that look flashy on your CV. So there's that ulterior motive piece that comes in. It makes it really hard because it's not necessarily what's valued in research. Another person told us there are no formal mechanisms for me to engage partners in the decision-making process. So I do try to do that, but my institution is providing me with no formal ways to do that. No training, no incentive. The opportunities are so low to take people who aren't professional scientists and have them contribute to science. No one is telling me to unless I have an internal little angel on my shoulder. If I can bring this back to what we were talking about when I told you about Chief and TTE, the spring salmon, essentially people are swimming upstream when it comes to research partnerships. They want to get there, and the water and the current is rough. So I thought I would let my colleague, Dr. Lee Schaefer from the University of Saskatchewan, tell you a little bit more about some of his challenges around partnership. He works on our partnership and also has a background working and engaging with Indigenous communities here in Canada.
Like if we think about recognizing, valuing, and sharing of diverse experiences, I think it really is an openness to understanding the context of the communities and the partnerships that we're working with. You might have a partnership or organization that is based on just programming. You might have a partnership or organization that's based on just grant writing and allocating funds to a particular group of individuals. So I really think it depends on the partnership and the organization, how you kind of negotiate that. And I guess that gets back to that maintenance of relationships, an understanding of individuals, a trust, a care, an ethical, a kind of relational ethic that starts everything off. So I guess no matter what the partnership is, in order to get to know what sort of is meaningful or what's authentic for a particular group or a particular organization, I really do think that relationship has to be fostered over time in meaningful and trustful ways. If you think about the creation of the IQT guiding principles and the amount of time spent with partners in a variety of different organizations, building trust, building care, I think putting your money where your mouth is in terms of saying, like, we're willing to put the time in here to really find out what might be meaningful for this particular partnership versus kind of deciding from a research perspective. So I guess it's kind of a cop-out in some ways, giving that idea that it depends, but I do think it all starts with that relationship. And I will say that, again, that's not easy because of grant deadlines, because of the kind of dominant discourses at universities and what's important, and graduating master's and PhD students in a timely fashion, and writing grants that are completed at the end of grant date, and writing publications that are published in a timely fashion. All of those things, I think, in some ways conflict with that relationship and with the trust that needs to be built over time. So I caveat in the sense that while all these things are amazing and can be implemented in meaningful ways, it takes time that oftentimes our institutions might not value in the same way that we do as kind of community-based partnership researchers.
I think
we
highlight some of those key things that we see are challenges. I told you that I can't tell you all of our research from researchers, knowledge users, and funders given the time, but I thought maybe I could provide some summaries and some of our key pieces that we think need to change from a individual, relational, and institutional level. And this work comes out of our several studies across researchers, knowledge users, funders, and institutions. So a few things our partnership has been thinking about is that at the individual level, we need to start providing practical, non-judgmental how-to information in terms of partnership. We need to highlight examples and models of partnership so we can see what that looks like and how people are navigating challenges. And we need to start looking at the implementation and the impact of our actual principles. If you're thinking about this in your own work and you're wanting to start today for some non-judgmental how-to information, I think the first thing you want to think about is, who are your users? Who are the individuals or groups that use or benefit from your research? And have you had a conversation with them yet about what is meaningful or useful to them? These groups are different than research participants. They're people that are going to have decision-making power with you in your research studies. When working with them, ask yourself, what does it look like to follow each principle? Use the principles to set clear boundaries for yourself and your overall partnership. What's okay, what's not okay, and how will you see and stop tokenism in the work that you're doing? You want to establish processes to hold yourself and your partners accountable for supporting meaningful engagement. And then, because the literature in partnership is so new, we do really need to start reflecting, iterating, and in particular, reporting on our process and outcomes of our partnerships, not just of our research. At the relational level, our partnership thinks we need to start providing training, education, and certifications to build relational skills, both among researchers and research users, as well as create and leverage our networks to build relationships between researchers and research users. And you couldn't have a better group in Minnesota with the North American Spinal Cord Injury Consortium and your number of other partners working together with NASPIC, just releasing their SCI research advocacy course as an example of work that's trying to push in that direction. And then at the institutional level, this is where we really need to start thinking about calming those waters. We need to start to value resource and incentivize research partnerships, not just ask for them when the grant is due, but really think about the system that allows for them. We need to create processes that hold research partnerships both accountable for meaningful engagement, but also really support them. And consider our metrics of research impact and merit that value the quality of the process and the experience, rather than just the quantity of our outputs. Ensure that our practices, structures, and processes don't actually create unnecessary challenges. People already feel like they're swimming upstream. Let's not make it harder for people to partner when we don't need to. If you are someone that does have some decision-making power on this presentation today, I would strongly recommend looking at this particular paper that was led by a member of our partnership and a really wonderful colleague, Dr. Catherine Sibley. She looked at how knowledge translation practices, including meaningful engagement, are recognized in tenure and promotion among some of the top universities within Canada. And what we see is broadly it's not. And we put out a strong recommendation that institutions need to explicitly and comprehensively consider how knowledge translation, meaningful engagement, dissemination, application actually are within tenure and promotion documents and guidance, and then align that documentation and procedures to reflect a value of partner research. So really, we're starting to ask the question, how do we support meaningful engagement in spinal cord injury research? What is it going to take to actually support meaningful engagement among bench science, among bedside science, clinicians, and among backyard scientists like me who work in community? As well as how can we start to support meaningful engagement across career stages? Some of these trainees and early career researchers might be having different experiences and challenges than our post-tenure researchers, and how we support in that process. And then lastly, I think we're also starting to really think about how we can see our unearned privilege and act in critical allyship with a intersectional group of partners and researchers. So who gets to be engaged in a research partnership? And how can we make sure that our partnerships are diverse and inclusive, not only from a spinal cord injury perspective, but across lots of identity? So I hope that this work today's presentation has helped you understand some ideas around tokenism and how our principles and our work is trying to help combat tokenism, as well as support meaningful engagement. And if I come back to how we started, how do we start taking care of one another in a good way in the research system? How can we rise tides to make research partnership better? And how can we really calm the water so that people don't feel like they're swimming upstream when it comes to partnered research? At the end of the day, I'm a Brene Brown fan, and I think that this is going to take integrity. We're going to have to start to choose courage over comfort and start to think about what is right over what is fun, fast, and easy, so that we can actually change our systems and our practices that they actually align with our values of partnered research, rather than simply professing that it's important. There's so many people that help me do the work I do, and I'm so grateful to all of them, as well as the funders. Particularly our partners and our trainees are really the people that drive so much of this work. If you would like to connect with our partnership, our research, any of our resources, there's our email and website, and we hope that we'll hear from you at different points. Thank you.
Thank you so much, Heather. Such a fantastic, engaging, and meaningful presentation. And at this time, we will open up the Q&A. So if people have questions for Heather, please feel free to put them in the Q&A box in Zoom, and Heather can answer them.
Oh, someone wanted to know if they could hear you. Oh, but you figured it out. I'm glad.
Yeah.
Like, oh no, I've been talking for an hour and no one could hear me.
I think it was the video.
Okay. Oh,
Yeah. So Heather, you've done a tremendous amount of work.
Oh, it's a big
Very-
group. It's not just me. It's a big group. It's really fun.
Yeah.
Any questions?
You're just so thorough. There's no questions. So I have a question for you.
Go for it.
You're frozen. Can you hear
Oh
me?
no, can you hear me?
Oh, there
Okay,
you are.
we
Yeah.
go.
Okay.
We're back.
So, we're required on a lot of grants, right, to have people with lived experience in the grant process. It feels very much like tokenism, like you said, kind of pulling people in at the last minute. Like, I have this idea. Do you support it? Do you want to be involved? And then also, I guess, how do you avoid? I know we need to do a better job from the beginning, right? That's what partnership is about. But as you're trying to build that, I think, how do you write the grant and give them everything you need while avoiding tokenism? So I guess a lot of times the feedback that I get is like, well, you didn't point out all the people with disabilities on your team, or you didn't point out that your team was, the diversity on your team. Well, that to me feels like tokenism, right? Like, I put in all of our policies that say, like, here's how we encourage employment from people from different backgrounds, people with disabilities. But should I be calling out the number of people in wheelchairs on my research team? I don't know.
Yeah,
How do you hit that? How do you hit that from a practical perspective? How do you hit that so you get the points for the grant and
Yeah.
not, tokenize people?
Oh, I feel like there's a few things that come to mind when you're like describing the challenge. So the first part is that the system's setting you up to have to talk about tokenism essentially, and is setting you up to do it. So there's a few pieces of the funding system that I think are really challenging, like very short deadlines, like from the time it's announced to when you actually get to do it. So you don't get a lot of opportunity to do meaningful engagement. So you would have to have your partnership already set up and like ready to go, which requires some planning on the front end. But I do think that there needs to be better supports for that, number one. And then when we get to the point of like kind of counting, right? We're counting heads and how many people have this and that. I actually come back to that piece of meaningful engagement and why. So is this work personally, socially relevant to this person? And is that because of their lived experience, their role, their decision-making power, and talking about that piece in my grant of why their lived experience and these other pieces are meaningful to them, if I can. And two, show in a governance structure or the way in which things are set up where they have decision-making power over the grant. So it's not just me doing like counting that I've got enough people with this or enough people with that. Like, do people have meaningful engagement that this is important to them? They're not just there to say, well, I'm here because I'm represented, and showing as much of that as possible. Now, that also is why we have to focus on institutions and funding agencies, because we need them to change their grant system to give us the space to do that. And we also need our reviewers to get better at meaningful engagement to look for that, right? So it's sort of a double edge. And as much as possible, we try to be as open and honest and transparent, both on the grant, but also with the partners. So sometimes I have to explain with our partners of like, the way this grant is set up, we don't agree with. And here's how we're going to combat that over here, either once we win the grant or beforehand. Is it a grant we don't even want to apply to now because it doesn't align with our values, which is the not fun, fast, or easy part? Or are we going to apply and then try and change the system from within? And so sometimes we have to give feedback to the grant organizations, to the different groups. So the system is not working for you often, and you're having to circumvent it, which is the swimming upstream part of all of this work. I feel like my answer is like, and it's hard.
No, that's
kind of helpful.
practical.
Yeah.
So there is, There is a question in the chat. So someone asked, how do you see researchers with specific interests and specialties engaging community members who have broader interests and priorities in research? Also, how many people living with the lived experience do you need to justify community perspectives?
Oh, last one I'm going to be like the classic academic and say it depends. I'll have to think on that. The first one, so I'm not the right partner for everyone. And many people, if for example, in spinal cord injury, have different priorities and different goals than what my research program can actually address. So my approach is to say, here are my skills. Here's the people I think would use my research, and go and talk to them. Now, if they come back and say, what we're really interested in is X, Y, Z, and that's not meaningful to me, and that isn't my background, I'm also not meaningfully engaged. So if you look at the principles, and I should have noted this actually, we say partners. We don't say researchers or research users in our principles. We say partners, because I also get tokenized on grants all the time. Like, I say no, but people will come to me and say, oh, you're the meaningful engagement person, so can you come on the grant? I'm like, oh, well, there's nothing in here that is like science of partnership or behavioral science or like changing systems. Like, those are the things that I'm excited about right now. I'm not the right person. I'm just going to resent you. I don't want to be on your grant, right? Like, so I have to be meaningfully engaged too. So there's both of those pieces. And I find that sometimes I play a facilitation role. So people will come to me, tell me their like really interesting research question. And I'll pass that on to somebody I know who does do that or ask. And I do think there needs to be better supports for getting a researcher who says, these are the things I'm really excited about. Anyone else jazzed about that? And finding someone else. The other thing is, who uses your research? So some of these research questions, the only person who uses that research is another researcher. And so engage that other researcher. This might not be the one where we take the time to have a huge community engagement process. It might not be that kind of question, but if it is that kind of question, we want to engage as diversely and broadly as is practically and financially possible. So how much is enough? I would say start with pragmatism. Start with, I personally think diverse is better. So the more diversity, the better, but not at the expense of letting perfection stop you from doing research that is valuable. And the size, I think, start with quality of experience and relationship. So partner on a level that is the size of partnership that you can manage and still follow principles. If you go big and huge, but you can't have quality relationships with people, now you're just doing quantity diversity counting. Build quality relationships. And maybe right now for you, that is like 2 to 3 people. And we have to change systems to allow people to build that way. But I think we do such damage when we have bad partnerships, because we don't just ruin your relationship with that person. We ruin the entire that person's entire engagement process, like for every researcher behind. So it ruined several projects. Sorry.
Thank you. That's okay. Can you share that last slide for me?
Oh, yeah.
Thank you. If there are questions that people have that you didn't have a chance to ask, feel free to email Heather. And then I just want to tell you about our next grand rounds. Well, first I want to tell you that the recording for this webinar, this grand rounds, will be posted soon on our SCIMS website with a link to our YouTube channel. So as a reminder, please see the chat for information on how to obtain CME credit for today's webinar. And at the end of the webinar, a brief 3-question survey will pop up on your screen, and we'd really appreciate your feedback. We also hope you can join us for our next grand rounds on Thursday, December 7th at noon Central Time, where the director of NIDLR, Dr. Anjali Forber-Pratt, will be presenting on disability identity. We do not have a title yet, but again, we thank you for joining us and hope you have a great rest of your day. Thank you so much, Heather. Great presentation. And we hope to see many of you next month. Thank you.